As we go from lines of therapy, I think the benefit of our treatment seems to be a little less each time. Patients are a little more beat up. They're a little bit more aware and a little bit more savvy. And so that initial discussion is often about being aggressive and intensive. Second line therapy, salvage, trying to rescue, save. But then there are patients now that are now still okay after 2 lines of therapy. And so they're a little bit more tired, a little bit more beat up, but not always, right? Because there's also these patients that have emerged who have kind of quieter pancreas cancer, and we've discovered them. Maybe we've caused them, we would hope, but we've certainly discovered them. And so that patient's looking around and saying, okay, you tried the standard medicines already, what else you got for me? So there is increasing to be a number of patients with 3rd line pancreas cancer. Never thought I would say it, but it's true.
In the light of having many options to treat patients in the advanced setting with pancreatic cancer, such as the frontline treatment, whether it's a single agent gemcitabine or gemcitabine-based regimen or FOLFIRINOX, there is opportunities now to use a 2nd line nanoliposomal irinotecan plus 5-FU outside of clinical trial. But the reality is we're not curing these patients. And now that we are focusing on quality of life and symptom management, there is an increasing proportion of patients making it beyond the 2nd line. They still have very good quality of life, very good performance status, and they don't want just to sit and have best supportive care. These patients often in my practice, are great candidates for phase 1 clinical trials. I'm not in favor of using empirically any of the pre-existing molecules and recycling them. There is no evidence that that provides any benefit when it comes to disease control or improvement of survival, except maybe cumulative toxicity. So I encourage patients to reach out to phase 1 clinical trials or some of these what we call basket studies that would consider patients with some molecular characteristic for enrollment on clinical trials.